Hello, everyone. I'm still letting a few people in from the waiting room, so we'll get started in just a second. Okay. All right, let's go ahead and get started. Just to give the students a little bit of a rundown. Thank you very much for coming today. I think this is going to be a great event. We have 3 alumni that work in psychology in the healthcare field. And we will be doing a little bit of a panel. So we'll be asking them some general questions. And then we will do breakout rooms. So you guys can then go into specific rooms and ask some individual questions that you have regarding their career path. So listen to them as they introduce themselves and tell you what it is that they're doing. And if you feel comfortable turning on your camera, we would love to see your faces. To speak to you. Thank you, Grace. I see you've got yours on. And to speak to you. So we can go ahead and get started. So I'm going to start with Suzanne. Suzanne, do you want to take a couple minutes and introduce yourself?
Sure. Hi, everyone. So I'm Suzanne Wheeler, and I am working right now in neuroscience outreach. I work at Barrow Neurological Institute. I've been there for about 17 years. I've been in this role for about 3.5. I have a bachelor's in psychology. My master's is actually in social work. And I went into that career field thinking I would do medical social work. And I did that for the first probably half or so of my career. And then that sort of evolved into more program management and working in the rehab setting at the hospital. And then that has further evolved into working in outreach. So now, my role is I do a lot of community events. I do some education. I work with a lot of different programs at Barrow. I work with the stroke program, the headache program, ALS, MS, pretty much all of the different departments within Barrow, which is essentially anything related to the brain or the nervous system in general, with the exception of our Parkinson's program and Alzheimer's and memory disorders, because they have their own separate outreach. So yeah, that's what I'm doing now.
Nice. Thank you. That sounds really interesting. John Paul?
Hi, I'm Dr. John Paul Bonadonna. You can call me John Paul. I got my undergrad in biopsychology, cognition, and neuroscience. I've always been interested in the brain. After undergrad, I moved to Phoenix to be a lab manager in a behavioral neuroscience lab. And at the same time, I was taking lots of classes, one of them with Dr. C, which was wonderful. Then I moved to Boston to get my doctorate in occupational therapy. Right now, I work as the lead occupational therapist at Imago Rehab. We are a Harvard-based startup. We focus on stroke rehabilitation via telehealth, as well as integration of assistive technology and rehabilitation robotics. I do a few other things as well. I'm per diem over at Spalding Rehabilitation Hospital on their stroke and neuro floor. I also do justice, equity, diversity, and inclusion work with a national nonprofit called the Coalition of Occupational Therapy Advocates for Diversity. I oversee 130 chapters across the nation, undergraduate chapters. I'm also a member of the Board of Trustees at the Massachusetts General Hospital Institute of Health Professions. I'm a lab instructor in the movement course over there. And until recently, I also was a research occupational therapist in the biodesign lab at Harvard, being the clinical role for designing and testing rehab robotics.
Nice. You're busy.
Fair.
Lots of things going. That's nice. Haley, you want to introduce yourself?
Sure. You shouldn't have made me go after those two. That is some robust backgrounds. My name is Haley Herdman. I am a child life specialist at Phoenix Children's. My background, my path was a little bit, maybe not the traditional course to become child life. I didn't know about child life when I was joining the workforce, but I went to school for more of like a business marketing degree. And later on discovered the field of child life and kind of looked into like, is this a possibility? Is this something I could, do I need another type of degree? Is this even an option? And so figured out I was able to use my bachelor's degree, and I added on the additional coursework that I needed to become certified. And it was a long road. It's a little bit competitive to get an internship in child life, and which I can talk more about as we get into, how to get into the field. But added on the coursework I needed and got my internship. And I also filled a lot of my experience with some volunteering. I was a bereavement support group leader, and I also volunteered at Phoenix Children's, and ironically ended up working in the position of the child life specialist that I volunteered under when I started. Like, I remember trying to decide if child life was the right career for me. So I thought, well, maybe I should go volunteer. What if I see blood and I faint? Or what if I, can't be around this? And I started volunteering at Phoenix Children's in our Center for Cancer and Blood Disorders. And maybe 3 years later, I became the child life specialist for that same clinic. So it's pretty cool. It came full circle, and I am very passionate about the clinic I work in and what I get to do. And if you're unfamiliar with child life, our primary role in the hospital is to provide psychosocial support to children going through medical treatment. So it's a lot of preventing trauma and providing preparation and education for what it is they have to go through in the hospital. It helps ease a lot of emotional discomfort and even some physical discomfort. We can provide distraction and advocate for pain management during pokes or procedures and things like that, and parental involvement. I could go on and on, but in the clinic I work in, since it is cancer and blood disorders, there is a lot of diagnosis education, and even helping siblings understand and helping advocate for kids to understand what they're going through, even if it's hard for parents to tell them. A lot of hair loss, coping, all kinds of different, self-esteem, things like that. Yeah, I think it's a little bit of the background.
Yeah, nice. Thank you. You guys are all doing very important work. That's very exciting. Okay, so let's start with a couple of the panel questions. Can you guys talk a little bit about your journey from undergraduate? So when you were choosing your undergraduate degree, finishing your undergraduate, to where you are now, and sort of how you made those decisions and how you sort of navigated the changes in your own life, and how you manage that with your career development. Suzanne, you can go
Sure.
first.
Yeah, sure.
Thank you.
So I think, like a lot of people, at least back when I was in school, I chose psychology because I wasn't really sure what I wanted to do. And I always felt like those were the most interesting classes. And so I thought, okay, well, I'll at least, I'll try to figure out kind of my long-term goals while I'm taking classes that I enjoy, thinking that that would lead to something within that field. And I actually really did kind of initially think that I would go into psychology and eventually get my doctorate and things. And then in between my bachelor's in psychology and when I started my master's program, it was about, it's just about 2 years in between finishing the one and starting the other. My mom actually went through a medical issue. She was diagnosed with stage 3 breast cancer, and she was treated at UCSF Hospital in San Francisco. And I remember being so overwhelmed, and she went through this high dose chemo and bone marrow transplant and this whole thing. And it was all very scary and overwhelming. And then I just remember the social worker came in, and it was like the first person that sort of made it seem like we kind of got it. Not that she wasn't giving us medical information, but she was sort of explaining how everything works. Not again, not clinically, but just like the process of everything that's happening and what would happen when it was time to go home, and kind of planning for that. And I was really kind of inspired by her. And that's actually what led me to going into the ASU Masters in Social Work program. That's how I ended up there, was really that person. So um, started there. I graduated ASU in 2000, so I'm dating myself. And one of my professors in the social work program, and to be honest, I'm guessing he's retired, I'm not 100% sure, but I knew that I wanted to intern at St. Joe's. That's what I really wanted to work at that hospital. And he happened to know someone. And he gave me her phone number, and he said, call her. She's an amazing social worker. And, maybe she can take a student. She takes students regularly. And I called, got her voicemail, and her name was Terry. And her voicemail said, this is Terry Burrish, and the outpatient rehab social worker. And I was like, outpatient. First of all, I did not want to work in the clinic. I wanted to be in the hospital. Rehab, I knew nothing about. And so, but it was kind of it was an in. This was a connection through my professor. And so I just thought, okay, well, we'll try it. If she's willing to take me on as a student, and she was. And I just completely developed a passion for rehab. So spent that internship year in 99 to 2000 there at Barrow Outpatient Rehab, where I got kind of a crash course in what it was like to, work with people who've had strokes and brain injuries and spinal cord injuries and all those things. And then I was fortunate enough to be hired to work in their inpatient acute rehab directly after graduating. So went from the outpatient side to the inpatient side, which was the goal all along. And I was really, really fortunate that they had a position open up in their inpatient side. And that's really kind of where my journey began. So spent the first 5 years or so working as a social worker. And in the hospital setting, social workers often work also as case managers, especially in the rehab unit. And so I found that I actually liked the case management sort of side of things even better than the social work side, although that really is, they go hand in hand in that setting. And then my husband got a job, and we had to move out of state. So did that, came back 3 years later when he was able to transfer back here, and went back to Barrow in the rehab unit, but was hired as a program coordinator for their traumatic brain injury program. So that I will say the one thing about working at Barrow, I've now been there for, I think it's about 17 years total, is that if you want to learn about the brain, the spinal cord, anything like that, there just is, and there, in my opinion, there's just no better place to do it, especially for a person who's, I'm not a doctor, I'm not an RN. There's just so much opportunity to learn. And so I really felt like I had a solid background in that. And so moving into that brain injury program coordinator role, that was really all about program development, looking at outcomes and quality. I helped develop their behavior management program. So my psychology and social work background were certainly relevant for that. Did a lot of different things. And then my husband's job moved us out of state again and came back in 2021. And I'm now in the outreach department. So my title is neuroscience outreach social worker and educator. I am more kind of general neuroscience. So we have our Parkinson's and movement disorders program. They have their own grant funded outreach. We have our Alzheimer's and memory disorders program. They also have their own grant-funded outreach. And then everything else within Barrow falls on me. So I have, I have stroke, I have ALS, headache, epilepsy, MS, or all neuroimmunology. The list goes on. So anything within the hospital that is an outreach initiative for all of those other programs go through me. And so now I'm out in the community, I'm educating people about what Barrow does. I'm connecting people with our research department. I'm doing some community education, things like signs and symptoms of stroke. We do some really fun events. My most favorite, I'm a baseball fan. I don't know if you can see my necklace, but I have a baseball necklace. My oldest son plays baseball. But we work with an organization called the United Stroke Alliance, and every spring, during spring training, we do some stroke awareness events in the spring training arena. So we do 3 different games. We bring our mobile stroke unit out and we educate people about signs and symptoms, and we get to watch a baseball game, and it's like the most fun 3 days of my year. So anyway, so I do pretty much anything that I do newsletters for 3 different departments. I do the stroke education. Right now we're doing an exhibit at the state fair for the mobile stroke unit. Stroke is probably the most robust program that I work with right now. We do lots of wellness programming, lots of walks, and the 5Ks and things. I'm helping coordinate all of that. So it's sort of I do whatever the different departments want me to do. Could be anything. So that's how I got here.
Nice. It sounds like you're sort of the collector of all the things over there, and
yeah,
all the
definitely.
things.
Yeah, but it's fun.
Nice.
It's different every day, and
Yeah.
every department wants to do something a little bit different, and that's a lot of fun. And I have a lot of freedom to create programs too. So yeah, it's a lot of fun.
Nice.
Yeah.
Yeah. Sounds interesting. John Paul?
Yes, my path was not linear whatsoever. So I was always interested in the brain, but when I was 17, I started having seizures and was diagnosed with epilepsy. And that is what really got me interested in the brain. And so when I went to undergrad, I couldn't decide between neuroscience or just pure psychology. And luckily, University of Michigan had a program that was sort of hybrid between two. And so I did social psychology work. After that, I was a lab manager. I met my partner, and his grad school brought me to Arizona. And again, a behavioral neuroscience lab. We were working on pharmaceutical treatments for cocaine, opioid, and methamphetamine addiction. I originally thought, okay, I want to go to med school. And then I was like, no, I definitely don't want to do that. And then I was sure I wanted to be a clinical psychologist. And then I was just confused about what exactly do I want to do. So I reached out to family, friends, anyone I knew in every single healthcare field. I found occupational therapy, and I observed in an outpatient neuro rehab. And that I absolutely loved. You really look at the whole person. You're on a long journey with them to recovery, not just physical, but also mental health. And it's not just, getting our arms or cognition improved, but how can we translate that into actual functional activities, socialization, getting back to work, leisure activities, etc. And so then my partner moved with me over to Boston. And the reason I chose my program was because I was interested in neuro and I was interested in robotics, because I that was a large part of the outpatient clinic I worked at. And I found a wonderful mentor, Dr. Susan Fasoli, who was really the first OT to work in rehab robotics and stroke. And I was lucky enough that she took me on as a mentee. And with her, I did a few clinical trials as part of my doctoral capstone project. And there I met Dr. Kristen Knuckles, who then at that time was working in the Harvard lab on this soft robotic glove. And after I graduated, she founded this startup, Imago Rehab, and she asked me to join. And I said, absolutely, this is exactly what I want to do, stroke plus robotics. So I've been working there ever since. It was kind of a big chance to work with a startup, and there's still some struggles working with a startup. But the wonderful thing about it is not only do I get to treat patients, but I've had a lot to do with program development, coming up with SOPs, using this new model that we use that also targets cognition with stroke patients. Not just, okay, let's get you better, but how can we get you to problem solve your own functional activities outside of therapy. I'm only seeing you a couple hours a week. How can you be your own therapist outside of that time? And then elsewhere, when I was in ASU, I co-founded the March for Science Phoenix. So I was really interested in advocacy. And so I continued that with DEI work over at MGH, and now I'm continuing that at the national level with the Coalition of Occupational Therapy Advocates for Diversity, or COTAD. I've always loved research, so I was lucky enough to get that position in the Harvard lab that created the robot that we use over at Imago Rehab. And yeah, this is where I am now. I love it. I love it.
Sounds like it, yeah. And you had like a very personal reason to sort of get started down that path, and then you just sort of ran with it, which is cool. It's awesome. Haley?
Yeah, could you repeat the question one more time so I make sure?
Yes. Yeah. So just talking about your journey from when you were an undergrad and choosing what, you wanted to study as an undergrad, and how you then took that into sort of your career now, and how you made those decisions along the way.
Okay. I mentioned how my path didn't start with any intention to become a child life specialist. In fact, I think if you went back like 10 or 15 years and said I told myself I'd be working in a hospital, I would have probably laughed in your face, because I started out, I was really into makeup after doing like theater in high school and just became really obsessed with that, and decided to get a bachelor's degree so that I could kind of, support whatever it was I decided to do. I mean, at like 17 years old, it's really hard to decide what to do with your life. So, it's like, well, I need to go to college. And so got a bachelor's degree, and it was in like fashion. It was business. I didn't want to start out, dropping that, but I did go to school more for fashion to kind of support the makeup career, blah blah blah. And I don't know if you're familiar with the movie Legally Blonde, but sometimes I joke that I'm like the Elle Woods of child life, because she went to school for fashion and then she went to law school, and she's like, what, like it's hard. And so I always but I think it's interesting because you have to pay attention to those little moments in your life that are like foreshadowing, because when I look back, like everything I used to do for fun or like volunteer to do, I used to volunteer at my church in the nursery with the kids. I didn't want to go sit through church, but just like put me in the room so I could play with the kids, and I would babysit, and I would was so excited to become an aunt, and just all these little things. I probably could list more, but it's just interesting how if you kind of take a step back and pay attention to what it is that brings you joy without trying, that kind of tells you a lot about yourself and what path you should take. And even during college, you get to take electives, so you get to sort of have the freedom to pick what it is you're interested in. And I chose like sociology and psychology and a few of those as my electives, and I really enjoyed them. And so it's interesting because those were able to help me when I decided to take more coursework to become certified, because those were some of the classes that I needed. So anyways, that all worked out just fine. I actually was kind of at a point in life that I was like, okay, what's next? Like we had my boyfriend at the time, my husband now, we had moved cities, and I was kind of at this point of like, what now, what's next? And he actually works at the hospital, and he said, Haley, there's these girls there's a couple boys too, but it's like teaching, it's a lot of girls. There's these girls at the hospital that work with us, and they get to like play with the kids all day, and they walk around with toys, and they're always playing with the kids. And I was like, I think those are probably volunteers. He's like, no, it's their job. Like, I think you would love it. And I was like, maybe in another life, I didn't go to school for anything like that. I'd have to start over. Like I'm already 20, whatever. Like I don't want to do that. So, and then something kind of hit me like, you know what, why in another life? Why not this life? I wasn't super happy with what I was doing. I still loved makeup, those kinds of things turned into like hobbies that I'll always love. Um, but it was sort of like, okay, why not? And so I looked into school, like I said, and there was the option to get a master's degree and things like that. And if I'd have known how long the path would have taken, I probably would have just got my master's, but that still could happen. And anyways, since maybe I didn't have education in my corner on my resume, that's when I started just really filling my time with experience, like all the different things that could give me what I needed to do the best I could in this field. So I got into ABA therapy. Someone mentioned behavior. I think Suzanne, you had said you did something with behavior. But anyways, that was fascinating. And I think I use a lot of my time at that job. I was doing behavior therapy, if you're not familiar with ABA, but it was behavior therapy for children with autism. I use that every day at work. And it was an awesome stepping stone. I volunteered at the hospital, like I said. I did the bereavement support groups, really anything I could get my hands on to gain more experience, because like I mentioned, it was competitive. And I think I want to make sure I'm saying all the things I wanted to say, but I think it was a huge confidence boost, because even maybe with my competitors who went to school for exactly the right thing and maybe got their masters or did these other things, I still was able to make it. And so I think it's a testament to, like, no matter where you started or what your plan is, you can do it if you really want to. And doesn't always matter what that piece of paper says. You just have to kind of fill in the gaps the best that you can, and figure out how to get where you want to be, even if it changes in zigzags.
Yes, that's right. Thank you. That's a very important point. I think we get our undergrads who think that they're going to graduate, get that job, and then they're just going to go straight, through their career path. And like nobody does that, right?
Mhm.
Everybody's sort of learning and moving and growing and maturing and just, interests and things change as you mature. So yeah, that's an important point. So thank you guys. So my next question is really, what are some of the job prospects like in your field or in your career area?
Well, I can speak to, I mean, I had a pretty narrow focus when it came to my degree, my master's in social work. But I mean, I would say that the possibilities are endless with that degree. You can work in almost any setting, but for me, it was pretty, I knew, before I even entered the program that I wanted to do medical. So, but there are social workers working throughout the hospital. There's social workers in leadership positions in the hospital. So, obviously we know social service agencies and things like that. There are a lot of social workers that go into more advocacy roles and that kind of thing. But for me, I can speak really more along the lines of medical, that the possibilities, at least within my hospital, are really endless. That I think a lot of people think to work in a hospital setting, you have to have a medical degree, right? Either an RN or an MD or DO or whatever. And that's really not the case. The director of the rehab program back when I was hired was a social worker. So, um, if you want to advance your career, it's certainly a possibility if you wanted to go beyond kind of the traditional medical social work type role. So, yeah.
Good. Yeah. So what made you want to you wanted to work in medical, but not be an MD. And was there ever a time when you thought that did you also think that you needed to have an MD? Or,
No,
yeah,
I knew I wanted to be in a helping profession. I thought, like I had mentioned earlier, I thought that I would go, do the whole psychology route, do the master's and then the doctorate, and eventually do that. I was very interested in neuropsychology, and actually, I think if I hadn't done what I did, that's probably where I would have ended up. But just sort of become, being inspired by the woman who was, the sort of the face of what was going on with my mom's situation and things like that, that really did sort of direct my my career goals. I did in the beginning part of my career when I started at the hospital. Ultimately, I thought I wanted to move up in leadership. And at this point in my life, I have 3 teenagers, and I like having the ability to have a little flexibility and get them where they need to go. And so I'm real happy where I'm at right now, managing programs and not people. And so, that's really how I ended up here. But if that changes, I do think that there are a lot of opportunities within the hospital for a social work degree. Um, I think that it's over the last 25 years or so almost that I've had the degree, I would say, in certain settings, maybe you struggle a little bit with really feeling respected. I think people sometimes have a perception of what a social worker is, and that may or may not really be what a social worker actually is. I think that's never really been an issue in my hospital, I would say. I've always felt like they have a real respect for what social workers do, which I think is evidenced by the fact that they have social workers in leadership positions. But I do also feel like that has sort of evolved over the years as well. It's not, um, it feels like that's less of an issue now than it was back, when I graduated. So I think that's a good thing.
yeah,
Yeah.
yeah, that work-life balance is very important.
Yes, definitely.
Very important.
Yeah.
John Paul, can you talk a little bit about what the job prospects are in your field?
Yeah, so there's a shortage of therapists, especially as we have an aging population. So there is a lot of room for what you want to do. And people typically think of an occupational therapist. So an occupation is anything that occupies your time. And they typically think of it as maybe rehab or school-based because those are the largest employers. But there is so much that you can do within OT. You can, like I specialize in brain injury or stroke. Certainly developmental disorders. You can be low vision specialist. You can work in a skilled nursing facility. You can do preventative care. We're now emerging more into primary care, hospice. I mean, the list goes on and on and on. So I would say what worked best for me was finding a mentor in the field that I wanted to go into, and that really led me into the field that I am now, which is more physical rehab. Um, mental health OT. A lot of people don't know about that. The field 100 years ago started as mental health OT. We kind of work similarly to a clinical social worker, a little different point of view or frame of references that we use. But that was my other training as part of 2 little mini residencies we had to do on a behavioral health unit. And I really loved that. And the other thing is you can change your field. If you're 10 years into, say, acute care and your body's really hurting from picking people up all day, you can find another field that you'd like to go into without having to do, for example, another residency like you would have to do if you were a physician. So there's lots to do as an occupational therapist that people really don't know about until they go into school and learn about it.
Yeah, that's nice. The flexibility is key there too. So you feel like you have places to move. Would you say trying to find a mentor, would some professional organizations for OT, would that be a good place for students to start to find someone or start reaching out to people? Is that a good place to start?
I would say if you know what you want to do, or sort of know what you want to do, look at your schools. Don't just go for, let's say, somewhere in the top 10 schools. Really look at the faculty. What are they doing at that institution? Does it align with your goals in your profession? And that's why I ultimately chose the school that I wanted to go to. But you can certainly look at other organizations such as AOTA, the American Occupational Therapy Association, lots of resources there. And then in the state you want to do, there's always going to be a state OT association. I'm in Massachusetts, there's MAOT. So there's lots of people that you can talk to, and a lot of mentors you can seek out. And it's all ultimately about networking, is how I have found, I think, every single one of my jobs. And I hate networking, but
I
as an
know.
introvert, but that's ultimately how where I got to where I am today.
I'd like to just add to that too. I think that's really important, the networking, because you know, and I can only speak to where I work, but at Barrow we have a lot of educational conferences, rehab conferences, nursing conferences, whatever. And that even as students, you can get discounted rates to come go to those conferences, talk to the people that are working in that field. Because I know even now, having been at Barrow 17 years, I'm learning about things that I had no idea. And these people are attending this conference. I learned we have a neuropublications department, and they actually have people who went to 2 years of medical school and then became medical artists. And I just thought, like, well, who even knew that that was a thing? So just go to those events, go, you know, if it's even something that you're remotely interested in, go to a conference. You can go for practically nothing and talk to people who are doing those jobs, and then you'll know pretty quickly if that's something that you think might be a good fit or not. But take advantage of those resources for sure.
Yeah, very true.
And I would also just throw in there is be interested, be curious, because I think people love to talk about themselves, and their spouses and their families kind of get sick of hearing about the same old stuff, and so they want to hear about. And so really, if you're coming in, and it's really a genuine curiosity. I agree with John Paul and Suzanne in terms of I think networking is so important. I also don't like networking. I don't like that's making that small talk. Ugh. But if you're coming in and you're being naturally curious, that I think gets people. I think people really like that, and they see that in students, and that's where they want. And I think I hear about Haley talking about, like, she may not have had the the educational credentials, so to speak, but it sounds like for you, you had this natural curiosity and this natural interest, and that goes a long ways towards making those connections.
Very true. Very true. So Haley, can you talk to us about what job prospects are like in your field?
Sure. I think traditionally child life works in a hospital. You'll definitely see a lot of child life specialists at a children's hospital, but they also work in adult hospitals because they still might have pediatric units. And there are child life specialists that work with kids sometimes of parents who have medical conditions. So if they are dying or they have some type of new diagnosis, during my internship, I did support a couple kids who had to, say goodbye to parents or things like that. So there's that type of support as well. In a children's hospital, you have the options of so many different units to work on. There's inpatient, there's the ICUs, there's the ER, and like for me, I work in a clinic, so I work outpatient, and your day can look totally different depending what unit you're on. If I were to talk to my colleagues, their days are completely different than mine. Like I do in the ER or in a clinic like mine, we do a lot of support for procedures like pokes and things all day long, like distraction and play, and just getting them through their clinic visit. Where if you're in a PICU where a kid is really too sick to get out of bed and play, you're providing a lot of bedside activities. And sometimes that means providing bereavement support. So we do help make like hand molds for patients who are dying or who have died. There's the PICU child specialist. She's like on a whole nother level of where I could see my career going, but she has gone like down to the morgue to get handprints sometimes. So there are sides of the job that you have to be prepared for, but it doesn't mean like I said, I've never had to do that. So it really depends what you're into and what you have a passion for, and the ones that support a lot of the bereavements and things, that's something that they really, it's really an honor to them. So they really do. I don't want to say enjoy it. I don't think anybody enjoys it, but I think there's a passion for that side of the work. And that being said, there's also Child Life that works in hospice settings. And so they are doing less like procedure support, less things that are painful, kind of like the kids that I'm supporting. I'm kind of helping, get them through things that might be painful or invasive, where in a hospice setting, you're going to do a lot of sibling support. So that is also something we provide, is support to the siblings. Sometimes cousins, or whoever is coming to visit, friends. There's times we've done school reentries, and we can go to the school and talk to their classroom about why their friend isn't in school right now, or or why their hair might look different when they come back from cancer treatment, things like that. And then there's also a couple of child life specialists that work with a facility dog. So that's kind of cool if you like dogs. They have their own therapy dog that they use for intervention. So one of our dogs here, when I've had to teach pill swallowing to a kid, try to get them to swallow their medicine, we had the dog swallow the medicine first. And there's ways we can utilize the dog to do interventions. So that can be something different. And then, we've talked about pivoting careers, but some child life specialists I know have maybe later gone in to do work like as a doula, like a birthing doula. And they've described it like, it's like the same thing. It's just now for what, like, not for a kid, but for a woman giving birth, but you're doing the same coping techniques and preparation and advocacy. And so it could be transferable if you decide to pivot your path ever as well.
Yeah, nice. The good